Right. So let's delve into one of my favorite topics ever, which is data. Genuinely, I love it. I'm fascinated by it. The whole big data concept and just how much data we're working with at the moment in healthcare. Now, obviously, we're looking at a pivotal moment in healthcare, especially post-pandemic, with regards to innovation. And your book discusses the unavoidable collection of data and the use of it by various entities. Now, for those who kind of really are still getting their heads around it, can you explain why this happens? What's happening with this data? What are the implications? And then I'd like to ask you a bit more about Dedalus's role in data collection as well.
Look, I think the inevitability of data sharing has always been there. A lot of the time we're giving our information away and not really even thinking about it. Of course, each region and each country has its specifics around the sovereignty and the controlling of data. But irrespective, data is always being, flows through to third-party companies that sometimes utilize that information, right, for different purposes. And you know, even if you think about today, our forget healthcare for a second, think about our banking data. I don't know where my banking data is, but I know where my healthcare data is. So, in fact, healthcare data is much safer these days and much more protected in its custodian relationship with each sovereign location. So that's one. And in terms of Dedalus, Dedalus goes through some really quite strict, stringent rules around governing data and works very closely with each individual cultural and country-specific rules to ensure the certification is met before we launch any software in any region. And that's really a critical part. And at the same time, we bring with us our knowledge from other regions. So we say, look, we understand you're doing it this way. However, we've done it in a couple of other ways. Would you like us to implement some of that knowledge that we've gained from other regions? So we do see a lot of the times that organizations take on, best know-how from other places as well, which is great.
Yeah, there's a lot of collaboration involved and knowledge exchange, that's for sure.
Absolutely.
And you know what? The whole banking thing, I never thought about it this way.
Yeah.
You always assume money is going to be more secure. You don't know why.
I mean, when you call a call center, that call center is somewhere not where you are, and they obviously have your banking data. So think about that for a moment, not to scare anybody.
Great. So speaking of scaring people, so one of the main concerns is the exploitation of data in general, just in healthcare,
Correct.
not reserved to any specific company. Look, there's a lot of talk in the industry. On the one hand, it's a pathway to enhance medical care, precision diagnostics in the future, etc. But also public perception is, they're going to use this data against me. It's going to raise my insurance premium at some point. So is it this, that, or a little bit of both?
No, I think it's a hybrid. I think it's a combination of those two things. I think the people who generally are in a bad healthcare situation, potentially it may rise their insurance, but at the same time, people who are healthier deserve to have a lower insurance premium, just as an example from what you're saying. But ultimately, data is there to help us as individuals to live better and longer and a quality of our lives. And I think we're still at the infancy of that, and we're learning how to take on that journey day by day. But I think people, and if you look at the rules around data governance, for example, in Europe, they're becoming much more relaxed right now, and they're starting to liberate a lot of that information. So we're seeing a revolution of liberation of data and the creation of an ecosystem of software providers that really help the individual to live that better quality of life based on the information that's been liberated.
What's your view on precision medicine here in the UAE? I mean, there's loads of MOUs and announcements and agreements, things happening. And do you think the future genuinely is all about, the future is precise, so to speak?
Well, look, I think, I'll plug in the book again, but if you do get a chance to read the book, there's a lot about how precision medicine now is working together with AI. And I think that's where the trick comes in. That's where the magic happens, right? When you have artificial intelligence looking at precision medicine, which is really not just medication, it's actually looking at a holistic view of the treatment of a patient. Because precision medicine looks at your tailor-made drugs, but also looks at a treatment plan that is really dedicated to that individual. So if you combine all those together and put them in an AI cube, if you like, you could really generate some amazing insights that could help, maybe not today, but certainly the days of tomorrow and the next generation and forth and so forth. So it's happening, it's here, it's unavoidable. So either be a part of the journey or sit back and watch everybody else have a much better, healthier life.
That's very, very true. Yeah.